Thank you for watching my video on brief psychotic disorder, case 2, Laura Gonzalez. Hello everyone, my name is John Salinas, and I'll be presenting case number 2, Ms. Laura Gonzalez. Ms. Laura Gonzalez is a 52-year-old freelance journalist who has brought herself to the emergency department requesting dermatological evaluation for a flea infestation. When there was no evidence found on the integumentary exam, the patient stated that she was unsafe at home and she was admitted to an inpatient psychiatric unit with a diagnosis of unspecified psychotic disorder. The patient has been concerned with financial stress. The patient has also a great history of depression, one episode which was treated and briefly resolved with an antidepressant. The patient does not have any relevant medical problems. The patient's sister had just recently been diagnosed with invasive cancer. The patient also has started menopause recently and ended a relationship with a boyfriend, and financial issues may force her to go back to her place of origin, which is Argentina. Upon the assessment, the patient was negative for suicidal, homicidal ideations. The patient was placed on a low dose of antipsychotic and symptoms resolved entirely in 2 weeks. Ms. Gonzalez's positive symptoms include that she's not troubled by depressive symptoms, manic symptoms, or paranoia. She does not use illicit drugs or alcohol. She has had one episode of depression, but has resolved briefly with the use of an antidepressant. Ms. Gonzalez also is negative for family psychiatric illnesses. She also has a negative screen for suicidal and homicidal ideations, planned or intent. Her negative symptoms include that she is stressed by financial issues. She's taking temporary renters. She's doing some pet sitting for her neighbors. She has been having some sleep issues. She's been obsessed with cleaning. Her sister invasive cancer diagnosis is also a stressor. Also her menopause and possibly moving out of the country back to Argentina due to financial issues. She also has a history of obsession with contamination phobias that have worsened upon the increased anxiety. The diagnosis for Ms. Gonzalez has been identified as brief psychotic disorder. With the diagnosis of brief psychotic disorder, a person loses contact with reality and experiences disturbance in perceptions. Ms. Gonzalez's distorted perceptions included that she perceived lint and plaster that she collected in a plastic bag while awaiting evaluation in the hospital lobby as fleas and larvae. She also had a belief that each time that a hair fell out of her head, it would morph into larvae. She also believed when she cried, a flea egg came out of her tear ducts. She expressed an unshakable belief that lint was larvae and that she was infested by fleas. The rationale for Ms. Gonzalez's diagnosis: according to DSM-5, individuals with brief psychotic disorder typically experience emotional turmoil or overwhelming confusion. Also, stressful life events are common before episodes of brief psychotic disorder occur. This is according to Rusaka and Rusters. Also, according to DSM-5, by definition, a diagnosis of brief psychotic disorder requires a full remission of all symptoms and eventual full return to pre-morbid level of functioning within a month of the onset of the disturbance. Evidence plan and treatment for Ms. Gonzalez. As stated by Mayumi, Satoshi, and Hideki, in their study, a patient was treated with 2.5 milligrams of haloperidol twice daily, and the patient responded well to the treatment. The patient's psychiatric symptoms disappeared within 4 days of the treatment. In Ms. Gonzalez's case, she was treated with a low dose of antipsychotic medication and seen weekly for supportive therapy sessions. Ms. Gonzalez returned to her baseline within 2 weeks of treatment. The treatment plan designed for Ms. Gonzalez would be 2.5 milligrams of oral haloperidol twice daily and weekly supportive therapy sessions in conjunction with cognitive therapy until the symptoms resolve and the patient develops enough insight to describe her previous thoughts as just a crazy thought. Thank you for watching and listening. The next 2 slides are my references used on this work.